Good evening everybody. I am Dr. Puneet CS, consultant neurologist at Sri Gokulam Hospital, Salem. Today I will be talking on a very common topic, like everybody in their lifetime will always have this at one point of their lifetime, that is neck pain or low back ache. So, before going into the basic aspects of neck pain, what causes neck pain, how do you treat neck pain or backache, we will just go through what are the structures which are attributed to causation of this pain. So, as we know, the structures of spine which contributes or which are responsible for producing pain are vertebra, vertebral disc, spinal cord, spinal roots and nerves, along with muscles and tendons. So, any abnormality in one of these structures causes a pain. This can be in the form of a disc bulge or extrusion, or what we say that one part of the disc comes out of the intervertebral disc and then presses the nerve root. Sometimes there will be misplacement of one spine over the other, we call it as spondylolisthesis, that can also cause pain. Sometimes arthritis, the bony changes in the edges of the bone can also cause pain. Sometimes as we age, there is formation of bony spurs, that also can cause pain. Sometimes there might be various other structures which are surrounding the spine, like abnormality in the muscle or a tendon rupture or a muscle contusion can also cause pain. And lastly, one of the most gravest is a tumor, like it can be in the form of a tumor in the spinal cord, the nerve root, or in the muscle can cause pain. So, see, lot of people will have a low back ache or a neck pain. So, when do you consult a doctor? So, if you tell that okay, all the neck pain patients or low back pain patients should consult a doctor, then whole of the world will be in the OPD room or in the hospital premises. So, who has to consult a doctor? So, the symptoms which attribute to a serious problem and we have to consult a doctor. It can be in the form of severe pain, in the form of patient is not excruciating pain, patient is not able to tolerate that pain, then you have to consult a doctor. If the patient is having pain and he has taken common analgesics and it is not subsiding within a week or two, then immediately you should consult a doctor. If the patient is having a past history of a trauma, like for example, patient has fallen down from a height or he has developed an RTA, then also he has to consult a doctor immediately, as immediately as possible. Then patient if is having weakness of one side of the limb, it can be in the form of upper limb or lower limb and any numbness, then also you should consult a doctor as early as possible, because this pain might be harbinger of a very serious disease. Then patient if he is having any abnormality in the form of urinary disturbances, patient is not able to control the urine or patient is not able to control the stools, then also immediately you consult the doctor. Sometimes patient will have pain during night times. They say that many a times if the patient is having severe pain in the midnight and gets up in the midnight, many a times it points to a malignancy. So, any pain is during the night time nocturnal pain, immediately consult a doctor. So, these are the things, and if the patient is having severe pain and which is not subsiding with a common analgesic or a painkiller, immediately consult the doctor. So, if a patient has this low back ache or neck pain, immediately consult a doctor, wherein we evaluate what are the causes for this pain and how do you go approach the patient. So, if a patient comes to us with neck pain and the low back ache, we always ask how did the patient get this symptom. It can be in the antecedent form of, like for example, if they are lifting a heavy weight, for example, in the household activity like lifting the gas cylinder or climbing a flight of stairs, like they climbing they will always be going to the pilgrimage wherein they will climb more than 1000 steps at the time, you are doing an unaccustomed activity. So, that is one thing. Then any other predisposing factors are there. If the patient is a diabetic or immunocompromised or patient is on steroid abuse. They say that if the patient is on steroid abuse, the longer time the bones get brittle. So, immediately you should consult the doctor, because sometimes we call it as an osteoporosis because of the chronic steroid abuse. The patient is prone for fracture and then abnormality of the spine in the form of compression of the spinal cord and the nerve roots. So, these are the medical history we take, and sometimes because of like based upon the age, if the patient is like more than 80 years and all, at the time we consider malignancy also one of the cause for the pain. Then how do you evaluate a patient with a neck pain or backache? It can be in the form of imaging. Imaging, what we do, the most common imaging this one is the X-ray and CT scan. X-ray and CT scan, they usually give information about the bone, the disc and surrounding the hyperlucent structures. So, if the patient is having fracture, we come to know with the form or any abnormality in the misplacement of the bones like spondylolisthesis and all, we come to know by imaging with X-ray and CT scan. Then we have advanced imaging like MRI. MRI gives detailed imaging, therein we will have a precise level and the exact extent of the nerve root compression, wherein it will give especially soft tissue imaging, like especially the intervertebral disc and other abnormality, whether it can be in the form of spinal cord or nerve roots. So, then there are other imaging, like we can also do some individuals like infection, like neuroinfection also can present with neck pain and back pain. At that time we also do LP only in certain situations. Once we diagnose, okay, this patient is having a backache due to a particular disease, like for example a disc extrusion or due to a tumor or due to any other thing, then we treat them. First is, it will always be in a medical management. Medical management also includes like non-medical management in the form of rest, adequate rest, heat fermentation, hot fermentation and all we give, and belts like in the form of cervical belt or lumbosacral belt, we always suggest adequate rest. Then, and we also encourage the patients to get active as early as possible, so that they will go back to their routine activity. Along with that, we also prescribe medications. There are two types of medication. One is the painkillers in the form of NSAID, common NSAIDs like diclofenac or aceclofenac, or in still more this one is tramadol and all, along with muscle relaxant. So, along with this we also give neuropathic medications like gabapentin and pregabalin and all, along with various other combinations. We give a course of 1 to 2 months and 3 months and all, then we observe how the patient responds. If upfront patient is having some deficits in the form of any weakness or sensory loss in a particular part of the limbs, we immediately suggest surgery. So, surgery will always be kept in the last, except in very grave situations wherein patient has trauma, there is cord transaction or the nerve root transaction, at that time, or brachial plexus injury, at that time only we go for surgery. Most of the times, many a times initial management will always be medical management, then we go for surgery. Then preventive measures like for example, if the patient is elderly and patient is on chronic steroid abuse, or patient has propensity to develop osteoporosis and all, we advise them preventive measures like putting lot of mats in the house wherein the risk of fall is less, and overall it is a holistic approach wherein both the caregivers and the patient is taught how to take care of the back, especially in the form of posture. Sometimes the most important thing is posture. We always tell them to keep the neck straight, sit straight, and use the pillow of a lesser height. We always suggest them to use the pillow which is of the lesser, the least height. Without pillow also it is fine, and always maintain the posture, because whatever disease we see at one particular point of time, it is a culmination of whatever posture they had in their younger days, in the childhood days, or this one wherein they will be like lying down in the sofa and all. So, at this thing, and the commonest professionals we are seeing nowadays with low back ache and neck pain is the IT professionals, wherein they sit in the desk for around 9 to 10 hours with the very large screen time. The other important group of people who develop this back pain and neck pain is traveling, especially in Indian roads, where we have lot of pits and lot of bumpers, and they will have lot of jerks. They many times they will be traveling around 50 kilometers, 40 to 50 kilometers per day. In those patients who travel continuously for many years together, that is one of the risk factor, and we should avoid the speeding of the vehicles, wherein the jerk can be reduced, especially in the bumps and the pit area. So, overall the care of the neck and the back, most important thing is the posture. The more upright you keep the neck and back posture is better, and try to avoid unaccustomed activity. Unaccustomed activity means what? You should not, like for example, you are a very sedentary lifestyle patient, immediately you go and try to lift on heavy weight lifting, or especially gas cylinder. This is one of the commonest thing I have noticed, and especially in patients who do their farming activity, they also are prone for backache at the later part of the life. Thank you.